Hello friends, welcome to OPHTHOSCION. So today's topic is ophthalmology. We are doing a series of lectures on ophthalmology, and this series is based on three parts. First is anatomy of the eye, second is physiology of the eye, and the third part is based on the clinical portion of the ophthalmology, which contains the examination of the eye, examination of the vision, and the last portion is diseases of the eye. So we'll first start about the anatomy of the eye. In anatomy of the eye, we'll have to know about the definition of the eye. So eye is an eyeball. Okay, eye is an eyeball, that is, remember these points, very important, aspherical. Second point is oblate spheroid. Oblate spheroid, cystic in consistency. Cystic in consistency, and it is kept distended inside the orbit, or orbital cavity by IOP. Now what is IOP? IOP is intraocular pressure. Intraocular pressure. It is about 11 to 21 millimeter of mercury. It is about 11 to 21 millimeter of mercury. Okay, so we have seen the definition of the eye. First is eye is an eyeball, that is aspherical, oblate spheroid, cystic in consistency, and it is kept distended inside the orbital cavity by intraocular pressure, which is about 11 to 21 millimeter of Ag. Now, as we have said that orbital cavity. So what is this orbital cavity? Now this orbital cavity is made up of bones, okay na, in which the eyeball is situated. So as you can see in this picture, this is the orbital cavity. This is the orbital cavity. Inside this cavity, the eyeball is situated. In a cross section, you can see this is the left eyeball, this is the right eyeball. Okay, and this eyeball is situated inside this orbital cavity. Okay, now as you can see, there are two walls of this orbital cavity. These are the medial walls and these are the lateral walls. Okay, now if we extend this portion of the lateral wall and this portion of the lateral wall, we will see that these two walls make an angle of 90 degree to each other. Means two lateral wall of the both right and left orbital cavities are perpendicular to each other, and these medial walls are parallel to each other, means they are on 0 degree angle. Okay, now in the eyeball we can see there are presence of two axes. Okay, first this portion and second is this portion. Okay, so this axis is called orbital axis. Okay, this axis is called orbital axis, and this axis is called visual axis. Means the orbital cavity, and this is the axis of this orbital cavity. This is the eyeball which helps in vision, or we can see a visual field through our eye. So this axis is visual axis. Now a very important point, this visual axis and orbital axis, they are making an angle of 23 degree to each other. They are making an angle of 23 degree to each other. Okay, next we will go to the structure of the eyeball. Okay, now an important point I have forgotten to tell you, that is Albert von Graefe. He is a very important person. He is called father of modern ophthalmology. Okay, remember this point. Albert von Graefe is father of modern ophthalmology. Okay, now we'll go to the next portion, that is the cross section of the eyeball and the structure of the eyeball. So as you can see, this is a cross section of the eyeball. Cross section of the eyeball. Okay, now this eyeball has 3 layers. Okay, first, second and third, or outer, middle or inner layer. Okay, it has 3 layers. Outer layer, okay, middle layer, and inner layer. Alright, so as you have learned, there are certain meanings of the color coding in every term in our medical profession or medical studies. So you know, we generally color the green for the fibrous part of a tissue in our body. So outer layer is also called fibrous layer. It is a tough and strong layer which protect the eyeball from the outside injuries. Okay, middle layer is obviously, as you can see, it is a vascular layer, and as you all know, the yellow color is denoting about the neural layer. Okay, so what are the names of these layers? Fibrous layer is called the outer layer, or it consists of cornea, sclera, and the junction of the both, junction of cornea and sclera, that is called limbus. Very important term in our ophthalmology. Okay, next, that is middle layer. It is also called uvea. Please listen here. This uvea contains 3 parts. First is from anterior to posterior iris. Okay, second is ciliary body, and the last portion is choroid. So do not say that the middle layer is called the choroid. Choroid is a part of a middle layer which is called uvea or uveal layer. Now the last layer is called retina. It consists of 10 layers. Okay, as you No, it's a neural layer, so there are presence of neural tissue here which accumulates and form the nerve. And which nerve? Optic nerve. Okay, this is the optic nerve. We'll go to the details later. And in this layer there are presence of rod and cone cells. Rod and cone cells which helps in vision. Now we have to know a very important point about these layers. These two layers, outer layer and middle layer, are complete layer. Complete layer. But this layer, the inner layer, that is called the retina. Okay. Inner layer that we are calling retina is an incomplete layer. It's an incomplete layer. Very important. Okay. So as you can see in this picture, this is a picture of an eyeball. Okay, cross section. This portion, this anterior portion is called, what is called? It is called cornea, because this is the outer layer, so it consists of two portions, that is cornea and sclera. Now anterior 1/6 portion, anterior 1/6 portion is called cornea. Okay, and the other 5/6 portion is called sclera. The other 5/6 portion is called sclera. Now there is the junction between cornea and sclera. This portion, this is called limbus or sclerocorneal junction. This is called limbus or sclerocorneal junction. Now inside this layer, that is the vascular layer. Okay, if we can zoom in this picture, okay, let me show you it in a new slide. Now see here, so as I told, this is sclera, this is cornea, this portion is limbus. Okay, so this outer layer. Now we'll go to the next layer, that is the middle layer. Now as you can see, these are some means you can see the pink color or red color here, means what? It is a vascular layer, because vessels are passing through this layer. Okay, some vessels are passing through this layer. Okay, now as I have told, it consists of three portions. First is iris, second is ciliary body, and third is choroid. So from anterior to posterior, this is iris. Okay, now iris, we can go from, wait, let me change my pen color. Okay, so this is iris. Okay, iris is a circular muscular structure, but we are seeing in a cross section, so bear with me. So this portion is iris. Now this portion is called ciliary body. Okay, this ciliary body has two parts. Very important point, please give attention. This ciliary body has two parts. One is pars plicata. Okay, one is pars plicata and the other is pars plana. Okay, So you see in this portion of the ciliary body there are presence of the rough structures here, this 1, 2 and 3. These bumps like structures, bumpy structures are present. This portion, this bumpy part of the ciliary body is called pars plicata. This bumpy portion is called pars plicata. And now this portion, plain portion of the ciliary body is called pars plana. Plain portion of the ciliary body is called pars plana. One point here, this pars plana of the ciliary body is relatively avascular. Relatively avascular. Now we'll go to the third part of the uvea or middle layer. Okay, that is the choroid. Okay, so here you can see between the retina and the sclera there is a presence of a layer. It is called choroid. It is called choroid. Now from this choroid portion, okay, there from this choroid portion numerous blood vessels comes and goes. Okay, numerous blood vessels comes and goes. So if we zoom this portion, okay, if we zoom on this portion or magnify this portion, we'll see some structures here. Okay, so I'll draw the structure. This, let me change my pen color. From inside to outside, these are the, you can imagine, these are the layers of retina. Okay, these are the layers of retina. So what we are doing? Choroid. We are seeing choroid in detail. So these are the layer of retina. Okay, from these layers the optic nerve goes, okay, optic nerve forms here and that goes outwards. Now this portion is sclera. This portion is sclera. So in between the retina and the sclera there is present the choroid layer. Okay, now here present the choriocapillaries. Is present the choriocapillaries. Artery is present here inside the choroid. These arteries forms capillaries. Okay, these arteries are forming capillaries here. Now in between these two portions, okay, this area is called supra choroidal lamina. Supra choroidal lamina. Don't be mistaken, because it is in the downside of the choroid. If you are feeling that it is in the down portion of the choroid, so it would be the opposite of the suprachoroidal lamina. But if you imagine the eye, the portion of the eye, okay na, the sclera, then goes the choroid, then goes the retina. So suprachoroidal means the upper portion of the choroid, that is the suprachoroidal lamina, and the blood vessels pass through this suprachoroidal lamina. Okay, numerous blood vessels pass through suprachoroidal lamina. Also nerve fibers passes through this suprachoroidal lamina. Nerve fibers also passes through this suprachoroidal lamina. So neurovascular bundles are passing through this suprachoroidal lamina. Okay. Now there is a presence of membrane. There is a presence of membrane in between the retina and the choroid. It is present here. Okay, na? There is a fibrous layer of membrane that is present here. Okay. The name of this layer is called membrana vitrea. Membrana or membrane of Bruch. Membrane of Bruch. Membrane of Bruch. Okay. Now in between the layers of retina and membrane of Bruch, there is present the cells which I have talked about. These are the retinal pigment cells. Retinal pigment cells. Okay. So this is the magnified version of the choroid. Okay. So some blood vessels are coming through this choroid portion. They are forming a capillary that is called choriocapillary. Choriocapillary. These choriocapillaries help to supply the blood in the layers of the retina, not the full layers of retina, some layers of retina. We will go to the details when we will study the retina. Okay. Now we will go back to the next portion. So we have seen the structure of the choroid. Now we will go to the third portion of the layer, that is retina. Okay. Now as you can see, I have told you in my previous slide. Okay. See this portion. I am marking this portion, not this portion. Okay. So from here to here, from here to here, this yellow color portion is called retina. This yellow color portion is called retina, but it is not complete. It is not complete. Look at these two layers, layer number 1 and layer number 2. They are continuing throughout the posterior portion of the eye and coming to the anterior portion and forming a complete layer. But retina is starting from here, going to the opposite side and ending at this point only, not going anterior. Okay. So this point is very important because it is called ora serrata. Ora serrata. ora serrata. Okay, so this mark the junction between the retina and the pars plana. Okay, retina and the pars plana of the ciliary body. Now in this retina, as you can see, there is a presence of the dip here. Okay, now so in C retina we see about the two portions inside the retina. One is the blind spot, one is macular spot, one is macular spot inside this foveal point. Okay, so macula or fovea, and other is blind spot. So as the name suggests, blind spot, in this spot there are absence or there are no presence of light sensing cells or retinal pigment cells. So here no image is formed when light comes to the retina. Okay, light comes to the retina, no image are being formed in this portion, that is blind spot. But in this portion, which is called macular area or foveolar area, there is abundance of cone cell which helps in our light vision. Okay, so most clear and sharp pictures are formed here inside the macular area. Okay, inside this macular area. Now we have discussed about the retina and the other two layers. Now we'll go to some extra parts of this eyeball. Okay, now let's go to a new slide. Now in this eyeball, as you can see, there are some structures remaining. That is, first we will talk about the lens. Okay, first we will talk about the lens. So what is this lens? This lens helps in converging or diverging the light rays. It acts as a lens, so it is called lens. Okay, now, and these lens, okay, this lens is suspended by these thread-like structures. If we zoom this portion, we'll see some thread-like structures. You see this, and this. These are called the zonular fiber, okay, or ciliary fibers, whatever you want to call it. Okay, these are the ciliary processes. These 1, 2 and 3, these are the bumpy structures are called ciliary processes, and these fibers originating from these here and here are called zonular fibers. Okay, these are called zonular fibers, which helps in maintaining the structure of the lens. Okay, it helps in maintaining the structure of the lens. Okay, by contracting in and relaxing, these ciliary muscles, okay, control the shape of the lens. Ciliary muscles control the shape of the lens via these zonular fibers. Okay, now one of the most important function of these ciliary processes are the production of aqueous humor. The production of aqueous humor. production of aqueous humor. Okay, these aqueous humor helps to maintain the intraocular pressure which we have talked about earlier. These aqueous humor helps in maintaining the intraocular pressure. Okay, now we'll go to the next part. So I have told you this aqueous humor is produced from these ciliary bodies. Okay, so now this aqueous humor have a specific pathway inside this portion of the eye. Okay, inside this portion of the eye. So it will go from, it will grow from here. Okay, and like this. Okay, so from here it will be produced and then it will go like this. Okay, so these aqueous humor which are produced inside the ciliary body, okay, this will travel from this portion to this portion, okay, and here also from this portion to this portion it will maintain the pressure of this area, that is called intraocular pressure. Now this portion of the eye, okay, this portion of the eye and this portion of the eye have two different names, right? One is called anterior segment and other is called posterior segment. So posterior segment and anterior segment. Okay, now this anterior segment, let us remove this part. This anterior segment is divided into two parts. Okay, in front of the iris and behind the cornea. In front of the iris and behind the cornea, it is called anterior chamber. It is called anterior chamber. Okay, and behind the iris, behind the iris to the anterior or in front of lens is called posterior chamber. So behind cornea to in front of iris is called anterior chamber, and behind iris to anterior or in front of the lens is called posterior chamber. Okay, so this anterior segment contains the aqueous humor. Okay, anterior segment contains the aqueous humor, which is produced from the ciliary body. So let us see some points about this aqueous humor. Okay, so this aqueous humor is liquid in nature, so it flows. Okay, due to being liquid in nature, this aqueous humor produced from here, then it goes to the anterior, where anterior chamber, from posterior chamber to anterior chamber. Okay, now second point is the volume of this aqueous humor, okay, is 0.31 ml, 0.31 ml, but it resides in two portions, that is, one is anterior chamber, then other is posterior chamber. So let us divide it according to the chamber, anterior chamber and posterior chamber. In anterior chamber 0.25 ml is present, in posterior chamber 0.06 ml is present. Okay, now as I have told previously, it is produced by ciliary processes. Okay, and the rate of production, the rate of production is 2.3 microliter, 2.3 microliter per minute. It's very important. I'm giving a double star. 2.3 microliter per minute. Okay, now next point is the flow of the aqueous humor. Okay, the flow of the aqueous humor or facility of the aqueous outflow, facility or aqueous outflow, also called C value, very important, also called C value. Now this C value is measured by an investigation. So if you have done your ophthalmology classes, or if you have read the books, you'll directly answer about it first without thinking, that is tonometry, but it is wrong. This is not tonometry, it is called tonography. It is called tonography. Okay, it's not tonometry. Now due to accumulation of aqueous, it exerts pressure on the eyeball from inside and helps to maintain its shape. Okay, and this pressure is called intraocular pressure, which I have told you about 11 to 21 millimeter of Hg or mercury, and this IOP is measured by tonometry. This IOP is measured by tonometry. Okay, so we have talked about the parts of the eyeballs. Now we have talked about the segments, and in the segment, in anterior segment, there is a presence of aqueous humor. We have discussed about the details of the aqueous humors. Now we'll go to the posterior segment of the eyeball. Okay, posterior segment of the eyeball. So this is posterior segment of the eyeball. This posterior segment of the eyeball, Okay, this is called the vitreal chamber. This is called the vitreal chamber. So in this vitreal chamber, there is presence of vitreous humor. Okay, presence of vitreous humor, just like aqueous humor. Okay, so this vitreous humor is present inside this cavity that we are calling posterior segment. ठीक है ना, the structure which is present behind the lens and in front of the retina. Okay, this vitreous humor has some specific points and specific some natures. First is, it is a gel-like structure, jelly-like structure. Okay, jelly-like structure. Next, the volume is about 4 ml. Volume is about 4 ml. Okay, now it is not produced or it is not replaced like the aqueous humor. Okay, it is not produced or replaced like the aqueous humor. So if there is a leakage of the vitreous humor due to some trauma, okay na, there will be a very important damage to the function of the eyeball. Okay, so we'll go to a next slide. So we have seen this is the vitreous humor, posterior chamber, posterior segment. Okay, posterior segment. Here vitreous humor, the first point was jelly like structure. Second is volume is about 4 ml. Third is not produced or replaced. Okay, so this vitreous humor has 3 degrees: first degree, second degree and third degree vitreous humor. So what is first degree vitreous humor? First degree vitreous humor which is present inside this posterior segment before birth. Okay, second degree and third degree both are present after birth. Okay, now we'll see the structure of this vitreous humor. We'll see the structure of the vitreous humor. So let us remove this portion. Though it's a jelly-like structure, it has some specific structural properties, and we'll see this. In a minute. Okay. So if we draw a eyeball here, this is cornea, this is sclera, that is complete layer. Okay, so there is a presence of iris, ciliary body, pars plana, and it is continuing as choroid. This is a rough structure, so don't mind. Okay, now here is presence of lens. Okay, lens. Okay, and now from here let us change the color. From here to the lens, okay, one membrane is present behind the lens, and here also. This is a rough diagram, okay, I'm telling you. So this portion is called anterior hyaloid membrane. This portion is called anterior hyaloid membrane, and from here the membrane is covering the other part of the vitreous, that is called posterior hyaloid membrane. Okay, now this posterior hyaloid membrane, is loosely attached. Okay, loosely attached. First point is loosely attached, and due to being loosely attached, okay, now there is a chance of detachment due to aging. Detachment due to aging. So when this happens, there is a very important term comes to the mind, that is called PVD. Okay, posterior vitreous detachment. This is a disease called, or condition, you can say it's condition, posterior vitreous detachment. Okay, so inside this vitreal cavity there is a presence of canal. As you can see, there is a canal present. Okay, there is a canal here. This canal is called hyaloid canal. Hyaloid canal. Okay, or it has a very peculiar name here, canal of Cloquet. Okay, canal of Cloquet. Okay, so for this vitreous to grow and from changing its degree, first degree to second degree and third degree, it requires nourishment. Okay, now so there is a artery which runs inside this hyaloid canal. Okay, there is an artery which runs inside this hyaloid canal. The name of the artery is hyaloid artery. The name of the artery is hyaloid artery. This artery supply the vitreous. Okay, now which vitreous? Now for, as I said, from first degree to second degree, third degree, to supply the first degree vitreous. ठीक है, this first degree vitreous starts regressing during, it starts its regression during third to fourth month of intrauterine life. Third to fourth month of intrauterine life. From this first degree, then second degree is produced from second degree vitreous, obviously, neuroectoderm. We will see the details about these layers, from which layers they are arising in the embryology of the eye, okay, later. So second degree vitreous is produced from neuroectoderm, okay, and inside this vitreal cavity, okay, there presence of various fibrous bundle, okay, various fibrous bundles, collagen bundles are present here. Collagen bundles are abundant inside this vitreous cavity. So which type of collagen? Type 2 collagen. Type 2 collagen is present, and some acid crystals are also present inside this vitreal cavity or vitreous humor. Along with this type 2 collagens, these are called hyaluronic acid crystals. So what I have seen up till now, that behind the lens or behind the anterior hyaloid membrane and anterior to the retinal part, there is a presence of a jelly like structure that is called vitreous humor, okay na? And this vitreous humor is not produced or replaced like aqueous humor. It consists of some collagen fibers, which is type 2 collagen fibers, and it also consists hyaluronic acid crystals, and it is transformed in a manner of first degree to second degree and then third degree. Now this first degree is supplied by hyaloid artery, and which is running through the hyaloid canal, okay, and after third to fourth month of intrauterine life, this first degree starts regressing and second degree vitreous humor is formed from neuroectoderm, okay. Now after second degree is formed, here second degree is formed after regression of the first degree, okay. Now after formation of the second degree, this third degree vitreous humor is secreted from neuroectoderm in ciliary regions, also known as ciliary, zonules, okay. So we have completed the transition of this vitreous humor from first degree to third degree. Now there is a question present. Sometime first degree vitreous humor persists in the canal of the cloacae, okay. Sometime this vitreous humor persists inside this canal of the cloacae. So this is the canal of the cloacae, which which is called hyaloid canal, sometimes first degree vitreous humor persist. This condition is called persistent hyperplastic primary vitreous, or also known as PHPV, okay, which is associated with a very important syndrome, that is Patau syndrome. That is Patau syndrome. Okay. So now we have finished about the basic portion of the anatomy of the eye. So we'll just revise about what we have learned here today. So we have learned about the definition of the eye, okay, the structure of the orbits, okay, and the angles which are forming between the lateral walls and medial walls, okay, and who is the father of the modern ophthalmology. Next we have studied about the eyeball structure, the layers of the eyeball, which is complete, which is incomplete, okay. Now next we have studied about the portions of the retina, what is macular spot, what is blind spot, okay, and the portions of the middle layer, ciliary body, iris, and the choroid portion. Then we have seen the part of the choroid, okay, now how choriocapillaries are formed and they are supplying the some layers of the retina, okay, how neurovascular bundles are going through the suprachoroidal lamina and supplying the anterior portion of the eye. Next we have studied about the ciliary muscles, okay, studied about the ciliary muscles, the aqueous humor which are produced from there. We have studied about the anterior segment, posterior segment. In posterior segment we have studied about the vitreous humor, the structure of the vitreous humor, the consistency of the vitreous humor, the volume of the vitreous humor, the contents which are inside the vitreous humor. We have studied about that. And we have studied the embryological transition of the vitreous humor from first degree to third degree, and if there is persistent vitreous humor, then it is called the PHPV, or persistent hyperplastic primary vitreous. Also it is associated with Patau syndrome, okay. So by this we'll end our first lecture on anatomy of the eye, okay. Next we'll discuss about the later portions of the eye in details, in like cornea individually, okay. Now we'll discuss each layer individually in our next lecture. Thank you everyone, and bye bye.